Hello everyone. Thanks so much for joining us. Just want to make sure that we can all hear me. Thank you, Leslie, appreciate that. We are excited to host this webinar today. We are using Zoom, and some of you may be familiar with our Adobe Connect services, but today we are using our Adobe Connect for another conference, and so Zoom it is. You may notice that you are muted. If you do have a comment, please use the group chat box, and if you'd like to ask a question or make a comment, I can also unmute you as well. We wanted to say a special thank you to Dr. Jackie Gray. We are excited to have her present for us today. We will be talking about the pathway to crisis recovery and resilience. My name is Natasha Peterson, and I am a program manager here at the National American Indian Alaska Native Mental Health Technology Transfer Center. And I am specifically in charge of the school supplement grant. Okay, so here is a map of our MHTTC network. Some of you may be already familiar with this, but we wanted to give you guys a visual of where we're located and where our other regional centers are located. So you can see that we are right there in good old Iowa, the University of Iowa in Iowa City. And this webinar is provided by ourselves, and we are funded by SAMHSA. We are part of this MHTTC network, which also includes 10 regional centers, a network coordinating office, and the National Hispanic Latino Center is the other center that is a national center. So for webinars, follow-up, we do give out CEUs. They are available upon request. If you would like to obtain CEUs for the session, please email me at natasha-peterson@uiowa.edu. Following this webinar, we will be emailing out a handout of the slideshow presentation that we give today. So as part of being in SAMHSA's network, we give out GIPRAs after each of our events. Participation in this evaluation lets SAMHSA know how many people attended our webinar, how satisfied you were with this webinar, and how useful it was to you. So I will be providing a link in the text box, and that will be linking you directly to the GIPRA survey. If you aren't able to fill out that GIPRA directly following the webinar, we will email that out as well. So I wanted to introduce our speaker today. Dr. Jackie Gray is a Choctaw Cherokee Research Associate Professor and Associate Director at the Center for Rural Health at the University of North Dakota. And she is the Principal Investigator of the, make sure I'm pronouncing this correctly. Oh, I wrote it down, hold on. Maybe Jackie, you can step in, pronounce it correctly for me.
Wachinyaya.
Thank you for the HOPE Project. She is a director of the National Indigenous Elder Justice Initiative, and they have been funded since the fall of 2011 to address the issues of elder abuse in Indian country. This project looks at Lakota youth and what gives them hope. She has worked addressing health, mental health, crisis intervention, and health disparities across Indian country and internationally working with Maori suicide prevention. Dr. Gray has worked with tribes across the U.S. for over 30 years. She received her doctorate from Oklahoma State University in 1998 and has been at the University of North Dakota since 1999. So with that, Jackie, I'll hand it over to you, and thank you so much.
Thank you, Natasha. Okay, I need you to stop sharing so I can share.
Just one second here.
Okay. There we go. And is it up for everyone now?
Yep.
All right. Good afternoon, everyone, and thank you for joining this webinar. I look forward to sharing some things with you about crisis recovery and resilience and developing teams that can help address that in your communities. First of all, I want you to think about what is a behavioral health crisis. What makes it a crisis? So to start with, what is a crisis? Well, it's a stage in a sequence of events at which the trend of all future events, especially for better or worse, is determined. More simply, it's a turning point. It's a time when things have been happening and you have a decision, or things direct you in a certain way that you end up going down one path or another. It's a condition of instability, of danger, as in social, economic, political, international affairs, leading to a decisive change. So all of these things are happening, and you have to make a choice as to what you're going to do next. A dramatic, emotional, or circumstantial upheaval in a person's life. And this is what we probably deal with more than anything. So when we look at the types of events that
there you go.
Are crises, you have accidental death, abduction, chemical spills, earthquakes, criminal escape.
Enter your meeting ID followed by pound.
Somebody is not on mute. So if you could put your
ID followed by pound. Otherwise, just press pound to continue.
I'm hearing your telephone.
You are in the meeting now. There are more than 60 participants in the meeting. This meeting is
if you could put your computer on mute.
Yeah, it is now. I just have to make sure we're muted over here.
Okay. So anyway, all of these different things, fire, flood, something with a gun at school, homicides, house fires, hurricanes, rape, suicide, teacher's death, tornado, tsunami, wildfire. There are so many different things that can be considered a crisis. And it's what are you going to do when one of these things happens? Because it impacts your community. And so why did we come up with a crisis recovery and resilience team as far as a way to address this? Well, from the perspective that we had when I was working on developing this, there was a lack of direct involvement. I was in Oklahoma working with the health department at the time, and whenever there was a local crisis, there was a hospital in Tulsa that if it met certain criteria, they would send some staff out within the first 3 days. But then they didn't know the local resources, they didn't know where to refer to, and they often didn't come out if it didn't fit their criteria. So we said we needed to look at things for our local people where they can excuse themselves from responsibility when they're emotionally involved in the crisis and have expert backup in the trenches to provide support, confidence, debriefing whenever a situation occurred. And when we talk about resources, those that are providing services in the local communities know what your local resources are. They know how to contact them, and the local sources are more available to those that need them than someone coming from 40, 50 miles away. You have an ability to follow up with people after they've dealt with the crisis to make sure they're doing okay. Do they need counseling? Do they need workshops or some type of in-service training with the schools or things like this is some type of support, whether it be housing or transportation or other things needed for those involved. So because we know what we have in our community, it makes sense for those in the community to respond to those crises and help link people to those services when they need them. Now, there is a lack of local resources in rural tribal areas. There aren't enough mental health professionals, the communications and knowing how to deal with the media when a crisis hits and they descend upon you. The hospitals and clinic services aren't available, sometimes 24 hours a day, 7 days a week. Are there programs to help support youth in dealing in these situations? And again, what are those emergency needs like housing, food, shelter, things like that? So looking at this perspective, we had a group of people that said, yes, it makes sense. We need to have something in our community. So we came together and trained those that were interested from the communities. It included people from the schools, from social services, from the hospital, from corrections. We had foster parents that wanted to be trained. Division of Child Welfare was involved, our health department, and eventually emergency management was involved with our group. But all that said, you know, we know what we have and we know how to access them, so we need to be providing this response in those communities whenever there's an emergency situation to help stabilize and recover from the trauma and better deal with emergencies in the future. So once we decided that's what we needed to do, we needed to figure out how do we do it. So the first steps in developing this crisis intervention and actually dealing with recovery and resilience was helping people to become aware that we do have some serious problems. We do have people in the community that have skills that can help. There's a support system that takes referrals and that protects and helps them. And we need to know who's available long-term in the community. Who's there that can help to lead this team that people will go to when they need help. So we did a survey of our local resources that we would have to support the system. And in doing that, we found out there were more than the ones that we were aware of that were interested in participating. The churches in that community were interested, and other spiritual leaders and groups that wanted to be part of the solution whenever a situation arose. We also provided some expert consultation to tell people, you know, why there's no assembly and you keep the students in smaller groups whenever there's an unexpected death. What do you need in terms of support personnel whenever there's an emergency? These were all things that we brought someone in to help answer those questions. And we looked at who was available as far as experts to assist with all of this. We found experts within the community, and we also had people that we could contact from outside the community that we could consult with. And then the availability of extra help while the community recovers, knowing that there may be situations that come along that may not be the major crisis, but they're the small things that happen in that recovery process following it. And who is there, and are they trained to help address some of those situations? Whoops. Okay. So how does it work? Well, first you have a crisis. Then whatever organization is impacted by that crisis steps in to figure out what they're going to do. When they determine what resources they need, they may contact other resources, or they would contact the crisis response and recovery team coordinator and let them know what's going on and what kind of help they need. The coordinator would then contact the crisis response and recovery team and let them know where to be and when to be there, and what the general plan was for providing that support and helping out the situation. We go to the response, wherever that is, and then afterward we debrief. We want to know, how did things work? How did they not work? How is everyone doing? What did they feel they were okay with? What did they not feel okay with? And using all of that to help plan for the next time we were called out and how we would handle the situation, what kinds of training we needed to bring in for people, what kinds of resources we needed to make available whenever we got a call for different things. Then we get together with that organization and our team and evaluate and make adjustments to our plan. One of the first things after we were called out the first time, the first time, we realized taking the time to gather up everything we needed and trying to remember that really didn't work very well. So we put together a bag that we kept in our storeroom that was our go bag. It had those things that we had found from the last response that were really essential that we have, and we had enough from our agency that we were taking to cover our staff and others when we went out to respond. So then how does this work? Well, we had roles. We had the leader or coordinator of the team, a resource coordinator that knew what the resources were and how to get in touch with them. We had someone that took the lead as far as media and communications and helped us, as far as any reporters that showed up or any things that came through the media, requests for interviews and things like that. We had a support person to know where and how we were needed, that as information came in, they handled making sure the right person had the information as it came in. We'd have someone in charge of rumor control. And that was a big one because there were all kinds of rumors that would jump up and people would start spreading them about what had happened. And so rumor control was a place or a person that could be contacted to address any questions that may come in as whether something was true or not. In some situations, it's crowd control. I dealt with a shooting situation where all of the parents descended upon the clinic because that's where all the shooting victims had been taken. And, they wanted to get in, they wanted to see their kids, but there were too many people and it would cause too much chaos in taking care of them that someone had to manage those crowds outside, gather information about, what their child was wearing that day, things like that, so that they could be identified. And we could put names to different people that were being treated. It's good to have a counselor or a psychologist involved. Sometimes you need a mediator to help deal with conflict situations and someone that knows how to intervene in situations. That doesn't mean that all of these are for a different person, but people may take different roles or multiple roles within your team depending on who you have. Okay. So what's expected of these team members? Well, first of all, they have to come and be a part of the training so that they know how things are going to be handled, what the process is that we're going to be following. And then they're involved in developing the structure, how that's going to work, the flow chart of, you know, how your response is going to work. They practice the procedure. It's good to have a practice session to kind of see how everyone responds. And then they meet periodically to identify situations that might have come up, or that they might have, after thinking about it for a while, thinking, you know, it would be good if we had this resource or that resource, or someone to be in charge of one thing or another, that helps to, that team will continue to evolve in what it looks like and how they respond. And they need to be willing to respond when they're needed in a crisis, and also to assist in promoting the team in their area. We did the initial team that I helped develop, we worked on a county-wide basis. And so we had small teams in each school. And then if a situation came up, they could call in the county-wide team to help provide supports. So how much time is it going to take? That's what people usually ask. How much time is going to be involved out of my life in doing this? Well, first of all is the time needed for training. We did a one-day training, and then every quarter, 6 months, we would do an additional training in a specific area that was voluntary, and then once a year there was a mandatory training for everyone. We had subcommittees that looked at, you know, what's the structure, the procedure, how we put things together. And another one on how do we get information out that we're here and that people can call us. There needs to be an availability to respond. What we did with the school districts is they agreed that if there was a crisis in another school district, they would release a certain number of their faculty or staff to respond and help with that crisis, knowing that if they had something that happened in their school district, that other school would respond in providing assistance for them during that time. And then when we have the debriefings and other meetings for updates and things like that, it's important to attend those. And we really tried to keep those to a minimum, but there were more initially as the team was developing and evolving. So I've told you a little bit about what's involved, the time commitment, who you may want to involve with the team and things like this. So where do you go from here? Well, first, you need to have a decision as to whether or not you want to follow this path. Do you want to go about developing organizational, school, or community crisis recovery and resilience team? And then you come up with a procedure in your subcommittees. You collect and identify information about resources that you have in your community. And I suggest doing it not only by people and materials, but for various age groups as to what they may need. You plan and schedule a training so that you can, a time where you can get all of your volunteers together that'll be a part of this team, that they can spend that day focused on training and not worry about their own calls from the office and things like that. And this is what we'll talk about at the end of my presentation as far as the opportunities to get access to training through the National American Indian Alaska Native Mental Health Technology Transfer Center. With your marketing subcommittee, you plan how you're going to get information out, how you'll get that information out in the schools, in the community, to let people know. And I know, because I was one of the coordinators of our team, it got to where after the first few months, people knew that I was involved, and I would get phone calls at home saying, Jackie, there was an accident at such and such intersection, and I think there were injuries. You better get ready to call out the team. This is before the police had arrived. I was getting the calls. So, but people knew that they could call and we would be available to start providing assistance. So that's when you set it up and you invite people to the training, so you can have that training. And then during that training, you'll also do some planning as to how everything will work, what your phone trees are going to be, how you're going to access people, how often you're going to call someone out, what's going to determine how many people you need to have. Sometimes too many is more of a problem than not enough. And all of those things, you'll work on deciding all of that for your community during your training time. With that, there are some links as far as the National Child Trauma Stress Network, the National Center for Mental Health Promotion and Youth Violence Prevention, National Center for Crisis Management, SAMHSA Disaster Technology Assistance Center, and I don't have the National American Indian Alaska Native Mental Health Technology Center, but all of those are resources for you. They have some really good materials that you can make use of. It doesn't mean you need to follow any one of those plans, but they do give you some good guidance that it might be good to be familiar with. So now I'm going to turn it back to Natasha to talk about the trauma resiliency training pilot study that they're planning.
Thanks, Jackie. Appreciate your wisdom and your knowledge in this subject. We wanted to talk about the opportunity that we have to provide a TA for 2 potential sites. You may, as we've been going along with this presentation, seen a need in your own community listed here, or want some more direction along the lines that Jackie has been training on. And we have decided that we would like to partner with 2 sites to provide trauma resiliency training and crisis team training to 2 locations. So we will be accepting applications starting now, and they will be available through May 1st. The idea of this application is to have this paper application submission, and then we will follow up with a video interview. Those applications can be found at www.mhttcnetwork.org/native. And I will also right now put the link in the chat box directly to the application itself. And just a little bit more about what we're offering. Jackie has developed a pretty rigorous curriculum that she has implemented, and it's what we're basing all of our training on. We will be offering 6 learning collaborative opportunities, and this will be held via video conferencing like we've been doing today via Zoom or Skype. And during those sessions, we'd like to walk you through this process of creating a team. So those things would be identifying key stakeholders, identifying traumas affecting community, absolutely considering our cultural considerations, community engagement opportunities, how to utilize media, just everything that Jackie went through today in this webinar. We also will be offering 2 face-to-face trainings, which we would organize around your schedule, but we were thinking early November and follow up in March. The idea is to get schools involved before the end of this school year. You have this idea in your head, and then you can talk about it amongst your communities, and then follow back up at the start of this next school year in the fall. So the tentative schedule would be initial meeting in late May. That's when we'll be getting back to you by for those applications. And this is a quick application. It's 1 page. We didn't want it to make it difficult, but we wanted to ask some questions about community readiness, and we're excited to get those back. And then we'll have this follow-up session in early August, and then 5 video conferencing sessions from August to December. And like I said before, those 2 face-to-face meetings. So we are anticipating this entire process to go from about May to December. That's absolutely subject to change depending on the needs of your community. But once again, the application link is found in the chat box or at our website. And if you have any questions at all, please feel free to email me, natasha-peterson@uiowa.edu.
Natasha,
Absolutely.
there may be some confusion with it ending December 2019, and you're talking about follow-up in March. What would that be?
Oh, yes, I'm sorry.
That's fine.
That is the wrong date. I'm sorry. Yes, we will be trying to finish those sessions, those video conferencing sessions, I should say, in December, and then we'll have a face-to-face meeting in March. And if we need to keep having those video conferencing sessions throughout January, February, we can do that as well. Thanks, Jackie. Yes, you can absolutely get a copy of the PowerPoint. We will be sending that out following this webinar, and we'll also be posting it on our website. And that's mhtttcnetwork.org/native. Jackie, I thought this would be a good time to maybe open it up for some questions.
Absolutely.
Pick your brain a little bit. So if any of you have questions, you can type it into your chat box, or you can unmute yourself. You should be able to find yourself, and there should be a little corner in the corner. You should click unmute, or just type the chat box and I can unmute you as well if you have difficulties.
Is anybody interested in possibly applying for one of these pilot sites?
Hi there, I'm Susan Mullane. I don't know if you can hear me.
I can, just fine.
I'm involved with a similar project in New England with training schools and teachers through the same FANSA grant. But I live in Alaska, and I'm traveling to New England at the end of the month for our initial training with our fellows. But here, as an Alaskan resident for 30 years and as a former teacher on the Northern Cheyenne Reservation in Lame Deer, Montana, I'm well aware of the cultural issues regarding trauma and resilience training. We have a lot of high suicide rates. One year we had 16 suicides on the Kuskokwim River Delta, which necessitated training throughout the state about how to develop resiliency in youth and minimize the impact of copycat suicides. I wanted to ask you about what occurs, the post-mortem rituals after a teen suicide particularly. Here in Alaska, they've changed the potlatch rituals in celebration of life so that teens are not wanting to be noticed in death. And so they tried to change it to noticing teens in life as a resilient strategy. I'm curious if for suicide prevention through American Indian reservations in the lower 48, if you've addressed that issue similarly as we have here in Alaska. How do you bury a child without and minimizing copycat suicides?
Yeah, I know there has been some work with that. Mainly that there had been, and it wasn't necessarily the cultural piece so much as that there would be, pictures hung at the school and things like that, that, like I said, the youth, I can be noticed and honored and all if I do this. And so we were able to talk about how that was done and find ways of honoring, again, their life, but not making it something to be that others would want to emulate as far as the suicide. And that had helped some, but there are so many other factors and all involved that it was more than that. Another thing was, not having assemblies following a suicide, because they just tend to feed off one another with that.
Yes.
And it brings lots of attention to that. And we really wanted to focus on their feelings and dealing with the loss and things like that, as opposed to bringing honor and attention to the suicide itself. We did have one situation where we had a group of youth saying that suicide was their culture because of the warriors that would go out and engage with the enemy so that the village could escape.
Right.
And seeing that as, being a culture of suicide. And so we had to bring in the elders to talk with them about that, what that was really all about, and that it wasn't suicide. It was striving for the good of the community. And if what they were doing wasn't striving for the good of the community, then it wasn't an honorable death. And focusing more that way.
That's a very good point, bringing in the elders. I appreciate your commentary on that. I will definitely write that down about the historical piece of warfare versus taking one's life.
And I am planning to be in Alaska the first 2 weeks of June.
Well, I will be here. And I am interested. I'm just wondering how it is and what this would look like in schools. That's my area of expertise.
Well, and I would be happy to talk to you more about that.
Perfect.
Other questions or comments? Interests in the possibility of some program like this in your community, or questions that you have that you're not sure about, whether it would be a good program for your community or not?
Jackie, it looks like we have a question. Oh, go ahead, sorry.
Hi, I'm sorry, this is Veronica, and I joined in a little bit late because we're actually at the TOR conference out in Minnesota. But I was wondering if this is going to be recorded so I could go back through what I missed.
Yes, we are recording this and we'll be able to have that up on our website after the webinar.
Okay, perfect, because it looks like a really awesome opportunity. But at this point, I don't have questions just because I wasn't able to hear the beginning. So thank you.
No problem. Thanks, Veronica. And you can find more details online as well at on our website.
Okay, perfect. Thank you.
So Jackie, it looks like we have comment here from Alfredo. It said, Dr. Gray, what are your thoughts regarding crisis management surrounding immigration? As you know, thousands of children were displaced from their homes, creating a national crisis. Who should respond to these types of situations when there are no advocates or consistencies across the country?
And that is very difficult when a lot of people that would like to be helping with this keep getting blocked out. You know, I think a number of groups have been trying to respond to those types of situations. But as I said, you know, being blocked out through the government, Homeland Security, border, ICE, all of that, makes it very difficult to provide any type of support and recovery or even advocacy for the children and the families. I think I just heard this week that they're saying at least 2 years to reunify all of the children with the families. And that is so devastating with that separation and the terror and everything like that. And I'm sorry, I just don't have a real good answer for you. I know the ethnic minority psychology associations have been, you know, trying to do some things, but, you know, I think a lot of theirs has been trying to advocate for reunification and things like that, but I don't know the specifics. I don't try to pull something out of the air when I don't know, and they're just things that we don't know about, and that's why pulling these community resource teams together so that you can share different perspectives and things like that can really go a long way in solving local problems. You're the experts in your community.
Jackie, I was wondering if you could talk a little bit more about the importance of having local teams as opposed to outside sources coming in at the time of a crisis.
Well, I know what kind of triggered us thinking about this initially was there had been a student shot and killed in our community. And the hospital had sent people over, or it had happened on a Friday night, and they contacted the hospital on a Monday, and they said, no, too much time had passed. They wouldn't send anybody out to help. And so we're like, you know, this doesn't do any good. And then when they did come out, they didn't refer to local resources. And so there wasn't any follow-up for anybody as far as any help for them or anything beyond just that day dealing with those emotions and everything about what had happened the day of the event. And so that's why it really became important for us. And I can tell you, we did our training on a Wednesday. On Saturday, there was a traffic accident that killed 3 cheerleaders, and I got a phone call, and we met. When I called the team to respond on Sunday, they said, this is a we're just playing this out. We're just doing a training, right? And I said, no, this is real. And when we got there and responded in the school, because of the training they had been through, we didn't even have to talk about things. We could just look at one another and knew who was going to respond and what they were going to do about it, and someone else could go on and do whatever else needed to be done. So it really worked well, and we were kind of surprised that it worked that well without having to practice.
Thanks, Jackie. It looks like we have a question from Leslie. Sometimes there are 2 camps, one where some members want to adhere to cultural traditions and the other where they are more open to Western approaches, especially regarding suicide. Can you talk to addressing this in a manner that integrates both camps?
I think it's really important to have both camps at the table and try to put together a a program or a plan that integrates both of those, because some of the youth are going to be more involved with the culture than others, or their families are more, or they may be more assimilated and not want to participate in some of the traditional things. So it needs to be where you've integrated both, and there's some choice there for those that have been involved with the crisis as to what they do, that you can offer them some options, but that they can decide which direction that they want to go as far as their follow-up and recovery process.
Thanks, Jackie. It looks like we have another question here. Katie, this is Katie from Northeast Caribbean Region 2. In regard to school mental health, have you encountered teacher and student wellness initiatives that have led to improved crisis response outcomes, or perhaps a reduction in trauma responses in your community?
Well, I can tell you that after we had developed the crisis team, I had been traveling with the high school speech and debate team, which are some kids that can get really stressed a lot too. And I walked into the school one day getting ready to travel with the team to a tournament, and the assistant principal turned to me and said, "Do we have a crisis I don't know about?" And I'm like, "No, I'm not here for that," because I was involved in so many other things with the school. So, you know, you can get different types of responses. But what we heard from the students is, why didn't we have this when this person died or when this person died? Why are they just doing it now? And it's like, because we learned that what we were doing when that first person died wasn't working. And that's why we put this together. And then they were fine with it. The other thing that we found as far as the teachers is some of them needed to be relieved from their classrooms to go do their own grieving and contact with someone. And so having additional people there that could step into their classrooms while they stepped out to take care of their needs was really important. I'm not sure that as far as the wellness initiatives, I'm not familiar with some of those. I've done this work a number of years ago, and so that was before they had any of those types of things. But I think moving in that direction and looking at that wellness focus is a much better approach than a lot of the just ignoring it that happened and some of the things that were much more negative. You're very welcome. Other thoughts or questions?
Yes, I have a question, one more.
Okay.
Regarding this initiative, it's all volunteer, is that correct?
That's correct. And it also helps to make it more sustainable by having that volunteer aspect to it.
I agree.
Okay. And Lori, you had a question?
I did, thank you. I just was wondering about for the community-based training. One of the things that I've been wanting to see more of is, training the trainers so that we can have community members recognize mental health emergencies, recognize when people have symptoms, and be able to be supportive. And would this study be doing some of this?
Well, and I think is the way we're planning on it, we would assist with some of that initial training. But if you have mental health professionals and others in your community that can take the lead on it and provide that training, maybe we can provide some additional assistance of materials and things like that, then that's what we want you to be able to do, is to keep it going within your community with the resources that you have. And I think as we were talking, I was talking with Natasha earlier, there may be some, minimal funds to kind of help get things set up, you know, maybe travel to a meet for you to meet the people around to come and meet and things like that initially to kind of help you get it off the ground.
Right. Thank you.
Other questions?
Yes, what was in the go bag?
Oh, we had pens, we had notepads, we had Kleenex, we had markers and the big Post-it notes. I don't remember what all we had in there now. I could probably go back and think for a while and recreate most of it, but it was
That's okay.
you know, those types of things that you would need in order to, you know where people were going and be able to take a note with you if you're going to get something, and you know, something to make signs with, you know, all of those kinds of things that we found out after the first response that we wouldn't have to go looking for them if we carried them with us.
Thank you.
Mm-hmm. I think after each trip, we ended up putting something else in the go bag that we found that, oh, we needed that and we didn't have it. Scissors, you know, all kinds of things like that you don't think about it.
Flashlights.
Scotch tape, you know, you realize when you're out there and you get ready to do something and you don't have what you need, that's when you know what needs to be in the bag. So I can try to create a list to start with. I think we entitled our training after our first year, our follow-up training, Who Brings the Kleenex? Because it was like, okay, well, who's going to be responsible for bringing these different pieces when we have an emergency? Because I think we got out the first time and we didn't have any Kleenex with us. And here we had all these people crying everywhere, and we were trying to come up with napkins and everything else because we didn't have any Kleenex.
The basics.
Yeah.
Yeah. There's power in a Kleenex.
There is. Well, Natasha has my contact information if there are other questions that people have. And, you know, we hope you'll consider applying for it. We're going to have just 2 pilot sites. So, you know, we would like to have people, you know, that are really interested in developing this, because we're going to put some time and effort into helping you pull it all together. So we'd really like you to think about it, maybe talk with some of the people in your community about it, and make your applications.
Thanks so much, Jackie. Really appreciated having you here with us today and for your insight and your experience. If anyone has additional questions, Jackie will be part of this resiliency training pilot study. So we are looking forward to working more closely with her as we move forward, and we would love to answer your questions and look forward to seeing those applications.
I'm sorry, Natasha. One of the things we'd like to do with this is to be able to kind of write up the process at each of these sites and be able to post that so other tribes that may be thinking about developing something like this have some models that they can look at and see what will work in their community or what might work or what they can adapt.
Yeah, our goal is to have a full fleshed out curriculum, almost like a toolkit that we can use in any tribe, and hopefully using the experience that we go through with these 2 pilot sites to solidify those processes. So Okay, thank you all so much for joining us today. And I'm going to quickly put the GIPRA survey link in the chat box. If you have time to fill that out, we would greatly appreciate it. And we hope that you all have a wonderful rest of your week. Thanks so much.
So